Good evening, I'm James Marsh, I'm the new Joint Medical Director. I want to talk about some very important components of care that have really made all of us who work in the NHS much more reflective about the way we work. I want to talk about the Francis Report and the Friends and Family Test. As many of you know, the Francis Report was published in February of this year, and it described a hospital in the Midlands, but it could have been any hospital across the country. It described events that happened between 2005 and 2009. It described a hospital that was very focused on its financial performance, and financially it was doing very well. It was also very focused on its targets and looking good to people who were judging it externally. And it seemed to be doing very well on all of those targets. We've heard from Matthew today, and we've heard from Krisha today, that this hospital, over the past year, has really made very strong movement in the right direction, both in terms of financial targets and our performance targets. And we have to be really careful that we reflect on why we're really here and what we're here for, which is about delivering safe and effective care. The Francis Report described lots of failings. It described a systematic failure throughout the whole NHS. It described failings among the commissioners, from inspectors, from the councils, the Department of Health, and anybody who was scrutinising the health that we were offering. And it described an element of failure at the front line. Many people working in that hospital recognised that the care that they were providing was substandard, and it just became the norm. There was a culture within that hospital where nurses and doctors felt intimidated about putting that challenge in, about what was wrong. GPs locally, commissioners, the council failed to put the challenge in. MPs, when local patients complained about the care to them, there were lots of opportunities to spot that this was a hospital that was going wrong. And we have to make sure that this isn't going to happen in Epsom and St Helier. So the report was published in February of this year. It was 1,500 pages long, and I know that at least one person in this room read all 1,500 pages. This is a word cloud, and for me, I think the word cloud is quite important. The 1,500 pages are, of course, really important, but the most common themes that came out of the report, what were the most common phrases? Culture, standards, caring, patient first, compassionate care. And I don't think any of us would argue that that is what we're really here for. The next 7 most common words and phrases: good faith, quality of care, values, training, education, responsibility, and candour. And I think these are words and phrases that should resonate with all of us who work in the health service. So what really did the Francis Report mean? What does it mean to us who work in Epsom and St Helier? We work in these buildings, but these buildings are more than, it's not just hospitals. When I give talks, most people when they go to medical talks, they usually, the first slide is usually a slide of the building that they work in. I'd much rather show the slide on the right. I work in the renal unit at St Helier Hospital, and it's about the people that work there and the patients that we treat. So of course we have to develop an action plan. The Francis Report had 290 recommendations across the whole NHS, and about 100 of them apply to us directly working in Epsom and St Helier Hospital. And our board would be negligent if they didn't ask us to analyse all 100 of these recommendations and develop an action plan to make sure that we're working towards, we're accountable to, and we're continually improving and delivering against this action plan. I can tell you what the themes of the action plan are. It's about patients knowing who their named doctor and nurse are. That the way that we handle complaints are much more transparent. That we have a duty of candour. We focus on compassion. Ward managers are able to take a step back from day-to-day care and really supervise the ward that they're looking after. And importantly, on the ward, we work as effectively as we can as a team. Now, these words are easy, but to implement these in practice are really challenging. I think if we go back to the NHS Constitution, it's a good starting point for all of us who work in the NHS to look at these common themes and to apply it every day to the way that we work. And to think about our own values when we come into work. Put the patient first. All 4,500 people who work in the hospitals here at Epsom and St Helier should not tolerate substandard care and should feel able to challenge and to strive for improvement. We need to work much harder at being open with our public, our stakeholders, our patients, our local population, about things that we do well, but also things that don't go so well. And I think we've got a lot of work to do on making our ward rounds much more effective and our ward care much more effective. So it's early days for us. What have we done? We've held some listening events. We've tried to talk to members of staff, frontline members of staff, doctors, nurses, but also importantly, people who don't work just there delivering care. Porters, managers, accountants, clerical staff, phlebotomists. We've held listening events with about 700 members of staff. And we've asked 3 key questions at all of these listening events. I'll talk about the friends and family test later, but we've asked that question to our members of staff. Would you recommend your service and the trust to a friend or family? We've asked, would you feel confident that if you had a concern that you could raise it and that it would be taken seriously and potentially actioned? And we've asked, what could you or we as an organisation do? What one thing could we do differently to improve the quality of care that we give? Now, these listening events have sometimes been uncomfortable. We've heard things that we don't want to hear. We've heard instances where care has not been something that we'd feel proud of. But we've heard very uplifting stories too. The vast majority of members of staff feel very positively. They would recommend their service, they would recommend our hospitals to their friends and family. Some of the themes that we clearly need to work on, and some of the things that are coming through, are that where people recognise that there's a concern, they fill out incident forms. And I think there's a consistent theme that we're perhaps not as good as we should be about feeding back to people who identify risk, and to feed back to the whole staff about big themes about risk, and we've clearly got to work on that. There have been common concerns about the number of nurses that we have and the quality of care that we deliver on the ward, and we're taking these on board. So what have we done? Some of the early changes we've made, partly as a result of these listening events, but changes we were making anyway, include making our ward managers supernumerary 3 days a week. That would hopefully free them up to really take a step back and look at the care that we're delivering, support their staff, and to make themselves more available to support doctors on the ward round so that we're effective in our communication. We've invested £500,000 on something called the Quality Directorate, which allows us to really get under the skin of what we do This hasn't been implemented yet, but we're in consultation about delivering this. Every single directorate in our hospital will have dedicated members of staff who will challenge, analyse, and we can assess from lots of different angles the totality of the quality of care, the compassionate care, and what patients are really telling us. We're certainly reviewing our incident reporting and trying to make it more responsive. And we want to launch staff pledging events where members of staff can pledge to do something extra every single day of their working lives to improve the care that they give patients. We don't want to stop there. We really need to listen to our patients. We recognise that in the past we haven't listened long and hard enough to what you've said. We've responded to your complaints. We've thanked you for the compliments. But we want to hold a number of engagement events, true listening events, to hear what you say about the care that we deliver so that we can continually improve. I want to move on to the Friends and Family Test. So this is a national initiative. Every single hospital in the country are asking the same question of every patient who comes into the A&E department or is an inpatient. How likely are you to recommend our ward or our department to friends and family if they needed similar care or treatment? And patients simply have to tick a box, from extremely likely to extremely unlikely. It's as simple as that. It's anonymous, so at the time we don't see what's filled out. And then scores are totted up in quite a complex way, and we get a score that can range from -100 to +100. And I'd like to take the opportunity to thank our patients, particularly our A&E staff who've really engaged with this at an early stage. And sitting at the back, John Needham has made a huge effort engaging staff, supporting staff, and making it possible for all of you to fill out these friends and family forms. So how have we done? This blue line represents Epsom and St Helier. These are the scores that we've achieved in the first quarter of this year. The Friends and Family Test was implemented in April of this year. And we've got a comparison against some of the local trusts. And the sort of shiny green line represents the average among the trusts in South West London and Surrey. And as you can see, we're actually quite pleased with the early responses that we're getting. We're getting very positive responses in terms of our total scores. When we break it down to different components of care, we're perhaps doing less well on our inpatients, and some of our local trusts are doing a little bit better than us. But our real star at the moment is our A&E department, where we're scoring extremely well. And we're getting very high response rates as well. The other valuable thing about the Friends and Family Test is looking at the comments that patients put. So there's a little space on the form for patients to put any comments. I've been with Matthew to open these boxes and to look at some of the comments and to feedback to staff. And on a monthly basis, John goes to all the wards and feeds back their ward scores and the comments that patients are saying about the care that's delivered locally. We're asking our ward managers to spend some time with staff each month to feedback these comments and to reflect on what they're really meaning and what we can do better. For those of you that have been inpatients, you've probably seen some of the notice boards on all of the wards. We're displaying them, and we want to improve the quality of the information that we're feeding back. So finally, we recognise that this is just the start. We don't want this to be one-off events. We really want to embed these changes. We want to strive for continually improving what we do and making ourselves genuinely open and genuinely putting the patient first in everything that we do. Thank you.